My pleasure to share my research at such a great conference. I thank you for your efforts and hope you to the research be valuable for you. I will talk about the effect of shockwave therapy on unused uterine fibroids in rats. I'm Rehab S Mamoon, Assistant Professor and Lecturer of Physical Therapy for Women Health, South Valley University, Egypt. The contents of my talk. I will talk about introduction, materials and methods, results and summary, and conclusion. Introduction about fibroid. Uterine fibroids or uterine leiomyoma are common benign neoplasms with a higher prevalence in older women and those of African descent. Symptoms about uterine fibroids. Fibroids can cause abnormal uterine bleeding, pelvic pressure, bowel dysfunction, urinary frequency and urgency, urinary retention, stomach pain, constipation, and also sexual symptoms as dyspareunia. The treatment option for uterine fibroids. Although fibroids negatively affect women's health, few conservative treatment options are available for women with symptomatic uterine fibroids. Surgery in the form of myomectomy or hysterectomy is currently the treatment available for fibroids with uterine artery embolization and focused ultrasound ablation as emerging less invasive option. In addition to the associated morbidity and mortality of these procedures, most of these options will potentially preclude or diminish the future fertility. So novel non-surgical alternatives for the treatment of uterine fibroid have been investigated. Alternatives for uterine fibroid treatment as extracorporeal shock wave therapy. It is a non-invasive treatment. Extracorporeal shock wave treatment are single acoustic high pressure pulses generated by electrohydraulic, electromagnetic, piezoelectric, or radial methods. Shockwave therapy are extensively used for treating kidney stones, different conditions of musculoskeletal system, and soft tissue wounds. The next slide. Our hypothesis for the research, the tissue response to shockwave depends on the intensity of wave. We hypothesize that low-intensity extracorporeal shockwave can restore the biochemical and biomechanical characteristics of fibroid connective tissue, causing fibrous connective tissue remodeling and shrinking. Based on the established biological effect of low-intensity extracorporeal shockwave as tissue regeneration, anti-inflammatory, and antioxidant and softening impact, we use this treatment and this modality for treating fibroid. However, high-intensity shockwave have a direct destroying effect on the lesion due to its higher energy, causing the fibroid to shrink. Our purpose of the study, please the next slide. The next slide, the purpose of the study. The purpose of the study is to investigate the effect of different doses of radial extracorporeal shockwave therapy on induced uterine leiomyoma experimentally in rats. The second purpose is to evaluate the role of extracorporeal shockwave as a new non-invasive method in decreasing uterine fibroid size by inducing a healing process mediated by inflammation. Materials and methods used in our research, animals and experimental design. The animals used, we used 30 mature version female Western strain rats, which obtained from Animal House of the National Research Center at Egypt, where the experiment were held. 27 rats of them were subjected to lyme-myoma induction using monosodium glutamate and estradiol benzoate. Another 3 rats were subjected to neither lyme-myoma induction nor shockwave therapy and served as control or negative control group. The preparation of monosodium glutamate for lyme-myoma induction, we used monosodium glutamate stock solution, and it was prepared by dissolving 20 grams of monosodium glutamate granules in 200 milliliters of distilled water. All rats in the study group received the daily solution of monosodium glutamate for 8 weeks by oral gavage. Estradiol benzoate was injected twice per week by intramuscular injection at a dose of 200 milligrams by dissolving 10 milliliter estradiol benzoate in 250 milliliter olive oil for 11 injections from the 3rd week till the end of the induction phase. The treatment phase for fibroids were 4 weeks. After the induction phase, the rats in the study group were divided randomly into 3 groups, Group A and Group C and Group B. Group A, 9 rats, received the treatment with low-energy radial extracorporeal shockwave therapy, and after 2 sessions, 2 rats were sacrificed, and the group called low to S2 group. After another 2 sessions, the rats there received the 4th session. Another 2 rats were sacrificed, and the group called low S4 group. The last 5 rats were followed up to 2 weeks for recovery, then sacrificed, and the group named low recovery group. The same in Group B, 9 rats received the treatment with high energy radial shockwave. After 2 sessions, 2 rats were sacrificed, and after another 2 sessions, 2 rats were sacrificed, and the group also called high S4 group. And the last 5 rats were followed up for 2 weeks, and the group also called high recovery group. Group C, 5 rats were not treated with shockwave therapy, and 2 of them were sacrificed just after the induction phase and named induced group, and the other 3 rats sacrificed at the end of the study and called induced recovery group. The application of shockwave therapy, that is the apparatus we used. Application of shockwave therapy. That is the parameters of shockwave we used in the low shockwave in Group A and high shockwave in Group B and Group C not treated. Rats were anesthetized by intramuscular injection of chloral hydrate and placed in a supine position for treatment. After applying ultrasonic gel on the lower abdomen using radial shockwave with 15 millimeter deep impact applicator placed perpendicularly on the lower abdomen. Then, the next slide, ultrasound imaging and Doppler scanning. The next slide, please. Blood samples. Blood samples were collected for further hormonal analysis every 2 weeks and 1 day after the final exposure by a retroorbital bleeding procedure by a hematocrit capillary tube. Tissue sample preparation. After rats were sacrificed, the uteri and ovaries were weighed and their gross diameter were measured using a graduated ruler, and the organ coefficient was calculated. Also, histopathological examination were performed and Mason trichrome was performed. Also, immunohistochemical examination to detect the expression of alpha smooth muscle actin was performed. Then data collection and statistical analysis of the study were performed. And our results, the graphs show gross changes of the uterine fibroids before and after shockwave treatment Gross picture for uterus in group, the picture A shows the negative control group, which received no shockwave or induction. Picture B show induced group, and picture C low S2 group, which received low shockwave and for 2 sessions. Picture D show high S2 group, which received high extracorporeal shockwave for 2 sessions, and picture E, which received low extracorporeal shockwave for 4 sessions. Picture F received high shockwave for 4 sessions, and picture G, low recovery group, and picture H, high recovery group, which received high extracorporeal shockwave and for 2 weeks after the treatment ended. And last picture I, that is for induced recovery group. The effect of leiomyoma induction and the treatment on the body weight, uterine weight, and the uterine coefficient. The statistical analysis used by one-way ANOVA test revealed that there is no significant differences in body weight in different groups compared to the negative group. A mean value of uterine weight. There were significant differences in uterine weight between different groups compared to negative group, and induced group recorded the highest value, while the negative control group gave the lowest value. Mean value of uterine coefficient. There were significant differences also, and the induced group recorded the highest value, and the negative control group gave the lowest value. Mean value of uterine horn gross diameter. There were also significant differences, and the induced group recorded the highest value, where the negative, and while the negative control group gave the lowest value. The effect of leiomyoma induction and treatment on circulating ovarian hormones. We studied estradiol and progesterone hormone. In the estradiol, we find significant differences between the groups compared to the negative control group. Induced group recorded the highest value, while low S2 group gives the lowest value. And in progesterone, there were also significant differences, where negative control group recorded the highest value, and high S4 group recorded the lowest value. The effect of leiomyoma induction and treatment on ovarian hormone receptors. Estrogen receptors, we find significant differences also between all groups compared to the negative control group, and high S2 group recorded the highest value, while low recovery group gave the lowest value. And mean values of ovarian hormones and progesterone receptors, there were no significant differences between all groups recorded to the negative group. We also find the effect of leiomyoma induction and treatment on total cholesterol and protein profiles. There were significant differences between all groups compared to negative group in mean values of total cholesterol. High recovery group recorded the highest value, while low recovery group gave us the lowest value. And in total protein, there were significant differences also, and low S2 gave the highest value, while high S4 gave the lowest value. And mean values of albumin, there also were significant differences, and globulin, there were also significant differences between all groups, while low S2 group recorded the highest value, and high S4 group recorded the lowest value. And also albumin to globulin ratio, there were no significant differences. Effect of leiomyoma induction and treatment on uterine horn diameters. Mean values of right and left uterine horn. There were significant differences in right and left uterine horn diameters in different leiomyoma induction and treatment groups compared to a control group, while the induced group recorded the highest value for right and left uterine horns, and high recovery group gave the lowest value. Effect of leiomyoma induction and treatment on uterine artery blood flows. There were significant differences in peak systolic velocity, and also there were significant differences between all groups compared to negative group in end diastolic velocity. Mean values of time average mean velocity. There also were significant differences between all groups, and also mean values of resistance index. There also were significant differences between all groups, while induced recovery group recorded the highest value and negative control group gave the lowest value. Also, pulsatility index, there were significant differences between groups compared to negative group. Mean values of blood flow volume, there also were significant differences between all groups, and low S2 group recorded the highest value, and low S4 group gave the lowest value. Finally, histopathological examination results. The next slide, please. Histopathological examination results of uterine section in control rats in the negative group. It is the picture on left upward. Negative control group shows normal uterine architecture, and the uterine induced group that is on the right above showed severe hyperplasia, hypertrophy, and vacuolar degeneration of endometrial epithelial cells. The group of low shock wave in the left down, low shock wave group showed mild improvement of the pathological lesion, where examined uterine section showed restoration of the normal histological pressure picture with mild vacuolar degeneration of the epithelial cells lining the endometrium. And the last picture was for high shock wave group, which show marked improvement of the histopathological picture with minimal degenerative changes. Mason trichrome stain. Also, examined section in control group showed mild deposition of collagen fibers in the endometrial stroma, which is the above left picture, and the induced group revealed significant increase in the collagen fiber deposition under the endometrium compared to the control group, which in the above right picture. Low and high intensity radial shockwave pictures, which down, right, and left shows marked improvement with decreasing of collagen fibers deposition under the endometrium. Immunohistochemical examination for the next slide for detecting the expression of alpha smooth muscle actin. Representative alpha smooth muscle actin immunohistochemistry of uterus, picture A, which show control group showing negative immunoreactivity, and picture B and C, induced non-treated group showing strong positive brown immunoreactivity of smooth muscle fibers in the blood vessels. And also picture D and E for group A and B, low and high shockwave treatment showing negative immunoreactivity. The discussion. In our present study, 30 Western strain rats were classified as the control negative untreated group 3 rats, and the other 27 rats received monosodium glutamate and estradiol to induce the production of uterine fibroid. And low intensity and high intensity radial shockwave was applied on the induced leiomyoma for different groups for 2 and 4 sessions, then followed up for a recovery period without intervention. Low intensity extracorporeal shockwave impacts the uterine fibroids through cavitation and shearing effects without extreme thermal effects that may damage other organs. These influences can trigger the anti-inflammatory and antioxidant effects for softening the tumor, shrink its size, and limit uterine fibroid growth. A supposed high-intensity extracorporeal shockwave influences the induced leiomyoma through degenerative changes which lead to coagulative necrosis and tumor shrinkage. Also, histological parameters were assessed to evaluate the contribution of shockwave treatment on the induced uterine leiomyoma. The histological changes such as decreased endometrial epithelial hyperplasia, decreased muscular degeneration, stromal inflammation control, and collagen deposition were investigated in the treated groups and non-treated groups. In induced uterine leiomyoma group, there was marked cystic dilatation of both the right and left uterine horns with asymmetry in size compared to the treated groups, and for low and high shockwave group, in which both horns were decreased in the size and with no dilatation or nodules. Histological analysis confirmed a decrease in the size of fibroid in the treatment groups compared with the induced untreated group after 4 sessions of low intensity and high intensity extracorporeal shockwave. Summary and conclusion of our study: leiomyoma formation could be induced using monosodium glutamate and estradiol benzoate. The experiment revealed that radial extracorporeal shockwave therapy can be proved to control the growth of uterine leiomyoma. Both low and high shockwave intensity presented promising results in the reduction of induced leiomyoma size, uterine hyperplasia, and uterine horn diameters, but high shockwave presented preferable results. Gross and sonographic uterine horn diameters decreased significantly by reaching near normal values after application of extracorporeal shockwave for 2 sessions and 4 sessions in comparison to self-recovery group. So 4 sessions are suitable for reducing the produced fibroid, and smooth muscle actin is suitable for immunohistochemistry marker for leiomyoma. We used the Doppler ultrasound, which was accurately determined the development of fibroid. And last, estradiol, progesterone, and estrogen receptors are suitable biomarkers for the development of fibroid and the return of uterine function to normally. It is the last